Greetings from EOL. Greetings from EOL Technologies. My name is Martin. I'm going to walk you through PRISMS, which is protecting infants remotely by SMS. So we developed this technology because we discovered that 2.5 million babies were dying globally, and most of these deaths were happening in the first week of life. And that's about the time when the newborns are actually still in the facilities. And over 90% of this death happens in low and middle income countries. And in Uganda, we've seen neonatal mortality remaining high at 27 deaths per 1,000 live births. In Uganda, additionally, most of the newborn care is being handled by midwives and nurses that lack sufficient specialist training to make clinical decisions for sick newborns. And therefore, we developed PRISMS 1 to aid the frontline health workers to provide appropriate care for sick newborns, hence leading to improved health outcomes for the neonates. And the second was to provide newborn care education. And lastly, we wanted PRISMS to provide instant newborn surveillance data for health planning and quality improvement. I'm going to stop sharing this screen and I open the technology screen. So PRISMS is a mobile application, and that's the landing page. It works off telephone network and off internet, and that's why we've been positioned to deploy in the remotest parts of Uganda. And so what a midwife has to do is to fully assess the sick child and input the patient number. So I'm going to enter that for test patient. I choose the ward where the patient has come from, the date of birth, he was born on 7th, and I'm going to enter all the other parameters. And at this point, of course, the midwife has done a full assessment of the sick baby, and they're just inputting assessment findings so they can get a management plan on how to care for the baby they have at hand. And so after entering all my assessments, I just confirm, and in about less than 8 seconds, I'll have a management plan that has investigations and treatment on how to care for this child. But this management plan that we generate is also similar to what a pediatrician would have offered for the same sick child. And any blue text that you see has additional clinical education content. So for example, if I wanted to know what give IV 10% dextrose is, I have a lot of additional information. If I don't know the dosage, PRISMS will be in position to inform me. And so once, of course, the midwife gets such information, they will be in position to care for the child at hand. And when they're doing a reassessment of the baby, PRISMS will definitely recall this child and will be in position to provide management plans where they can monitor growth rate, where they can get a calculation on how much feeds to give the baby in case the baby is not feeding well, and they can also discharge through PRISMS. Now, I said that PRISMS works off telephone network, but when you go to these facilities, we connect these devices to phones because they save the content locally on the phone. And once we connect these devices to internet, the data is synchronized with our server. I'm going to walk you briefly through our server. So this is the server. So I'll quickly log in. All right, so this is the server. So once we log into the server, we'll know, of course, how many devices activated with PRISMS. We know how many plans we've generated for the for the sick babies in the different facilities, and that's over 96,000. We'll know which devices are deployed and how they're being utilized in the different health facilities. But important to note, on this server, we have the quality improvement indicators module, which is very critical for PRISMS technology. And I'm just going to briefly show you a single report. Search for Cavalry, information that came in Jan. So before we go into provide quality improvement in the different facilities, we first of all use the data that has come in and see how the facilities are performing. We can see how this facility is presenting for thermal care indicators. We can see a lot of information from this facility, and this informs our decision on the kind of quality improvement meeting we should conduct in such a facility. And for example, if we looked at the babies that died, and we looked at the data that came in from the babies that died, we'd be in position to know the kind of areas in which the midwives actually lack and where they need empowerment, and be in position to focus on that. And of course, there's a lot of information in this dashboard that, of course, we share with the different facilities that we support, and that way we've seen improved health outcomes in those facilities. And of course, PRISMS has also showed us that facilities that are utilizing PRISMS very well, the in-facility neonatal mortality has gone down. So briefly, that's PRISMS, and that's how the technology works. We'll be happy to participate in order to increase our visibility and share with the rest of the Ugandan community about our work in PRISMS. Thank you.